Most Honorable Andrew Holness. Prime Minister.
Good evening, everyone. Coming out at short notice, and thanks for waiting on the Cabinet to complete its deliberations. We know that we are in an emergency situation, but nonetheless, we don't take your time for granted. So again, thank you for your patience. This press conference is a report on the meeting of Cabinet, but it is also an opportunity for the Ministry of Health. The Minister of Health is here with me, and we will be joined shortly by the CMO and the Permanent Secretary in the Ministry of Health, and they will give more updates as to what has transpired since the last time we updated the nation. This press conference is also in keeping with the protocols that we have established, that as far as is possible, we will be giving regular updates to the people of the country. The greatest weapon in the fight against the spread of this disease is accurate information. That is the greatest weapon. And therefore, the government is establishing itself as the source of accurate information. And even if the information is already in the public domain, the government will come and state the positions officially. We have to do this because there is, and naturally will be, though there are some deliberate attempts at misinformation, but there will always be a certain element of panic and fear. It is natural, and we understand. And as we progress through this crisis, we expect that with the stance that we have taken on being accessible, on providing information, that panic and fear will subside. However, we are also confident that all Jamaicans will adjust their behavior by accepting the information that is given and change the way in which they would have normally operated. Change is always difficult, but if we bend our minds to it, like I bent my mind a while ago coming into this room to go to the hand sanitization station, got some hand sanitizer on my hand, and I did my 20-second routine, and I believe I'm good. All right? I'm going to avoid touching my face, something that we always like to do, and I shake a whole heap of hands all the time. But now it's, and people seem to like that. We have to maintain what is called a healthy distance. What is it called, Chris? Social distancing. Hard for us to do. We are sociable people. But they say 1 meter, that's about 3.5 feet, or safer 4 feet away. And those measures should help us to contain. The disease is not a death sentence. In the initial stage, the panic everybody will feel, but we are not saying that be careless and get the disease. That's not what we are saying. What we are saying is that if you follow the recommended procedures, it is highly likely that you will not get the disease. So the personal responsibility is very important. Now, government has some responsibilities as well, and I can't speak to the medical, technical issues. The CMO will speak to those, and neither can I speak with any expertise to the public health issues. The CMO, the Minister of Health, and the Permanent Secretary in the Ministry of Health will speak to those. But government has to declare the overarching policy positions that will set the context within which we all operate. And what I want the public to understand is that you have a government, I'm not even saying now an administration, but you have a government that has a framework set by legislation. There are many laws in Jamaica which controls how we act. You have the Quarantine Act, You have the Disaster Risk Management Act. You have all kinds of laws for which the government must follow. And we have experience in dealing with outbreaks. We have had outbreaks of influenza before. We have had other outbreaks. And so we have residual experience, institutional knowledge to manage these things. So, again, that should give you some assurance that there is no need to panic. There is need to be concerned, yes. There is need to increase your level of awareness, but you don't have to go to the store and buy out all the food and all the hand sanitizers. You know, you don't have to do that. And remember, if you alone have hand sanitizer, that doesn't protect you. So, the government of Jamaica is now confirming the second imported case. It is a second case, but the second case is also an imported case of COVID-19. And this second case is a non-Jamaican who is also connected by travel from London. Having said that, the cabinet spent an extensive period of time discussing travel restrictions relating to the United Kingdom. The government is actively reviewing the extent of travel restrictions related to the United Kingdom. In short order, we should be saying some more on that. As you would know, there are several considerations, but the cabinet spent a long time discussing the issue, and it is something that is of great concern to us now. But again, we don't want to act in a premature way. We don't want to act without fully contemplating all the issues. That's our obligation to the citizens of the country. Cabinet has approved protocols for the closure of schools. However, those protocols still need some further consultations. For example, we have the Minister of Education, Minister Samoud, and I'm correct in saying that, has held consultations with teachers and the regional staff and the central staff at the ministry. There are aspects to the plan which require, for example, we need to answer the question, how would children who have examinations coming up, PEP and CXC, how would we not disrupt their training and their tutoring? And therefore, we have some measures that we have put in place, for example, the use of public broadcasting, radio and so forth, and we just need to do some fine-tuning in the consultation. That will be done over a period of 24 hours. But it is also important that we give some hint, some notice almost, because if we were to just abruptly close school, parents some of them would be in a quandary. How do we make provisions for the home care of children? So we are signaling, and I'm hoping that our parents will start to make the necessary preparations and be able to respond should it become necessary. And that is the important point. The government is placing ourselves in a position to act should it become necessary. And for us to act, the parents themselves should be in a position to be able to fulfill the action faithfully. So we have approved the protocol. We have not yet issued a ban on schools, but a closure of schools. But it is, again, actively considered. Now, just to say that there are some institutions, some educational institutions that have already decided to close at the university level or the higher levels of education. We endorse and support those actions because they can immediately take those actions without significant disruption. So those actions that have already been taken the government supports and endorses those actions. The quarantine authority is to be convened. Well, it is already convened, but now the CMO will now seek to have that authority issue new guidance and rules to make it, well, I hate to say the term mandatory because that got me into trouble once, but to direct special measures for the purpose of questions to be answered and information to be supplied by persons who have been on or aboard any ship or aircraft. Essentially, to put in place measures to enforce the giving of information. So we need to have the complete information of persons who are coming into the country. And you will understand why this is important in the next point that I'm about to make. And the CMO is here now, so further details I'll ask her, and probably ask you if you would come up and join me now, CMO and PS of Health. Where the law requires the granting of a permit for any event or gathering, no permit will be issued within the next 14 days. So that means any event, any entertainment event, any gathering that requires the issuing of a permit, we will instruct the permitting authorities, the police and the municipal councils. Did I just touch my face? And the municipal councils, at least I'm conscious of it. I'm trying my best. And the municipal authorities not to issue any permits. Permits that are already issued will be rescinded, revoked. Effectively, we are placing a ban on those forms of gatherings. However, that is just a part of the problem. There are still private entities, businesses that are having meetings, weddings and funerals and Sunday morning church service. We're asking the public, and this is where responsibility comes in, personal responsibility. Government has a limit to what it can do, and that is the nature of our society, and therefore the good civic understanding and good civic leadership has a role to play. In these gatherings and events, we ask that you follow the protocols that have been established for personal care and hygiene, that you have these meetings conducted as efficiently as possible, that you avoid close contact, maintain as far as possible the social space, that's what it is called, the social distance, and do all the things that we have been saying. We are not at the point where we would seek to enforce it. We are enforcing what we can do within the law, and we are therefore asking citizens to use their own discretion. On that note, there are persons who will be traveling to Jamaica from countries that have an increasing infection rate. And there are persons from Jamaica who may be wanting to travel to countries with an increasing infection rate. We would advise strongly against that at this time. Non-essential travel is not recommended. The government is leading by example. No ministerial approval for non-essential travel. In fact, it must be a dire emergency for my pen to go on the paper to say approved for travel. The Cabinet Secretary has also been informed, and therefore the entire civil service is also on that rule, and in fact the larger public sector is on that rule. No non-essential travel. Have I covered everything? Yes. So, generally, I think that based upon the plans that we have had in place, based upon the response so far, we have been handling this crisis fairly well. I must make mention of the financial provisions that have been made by the Minister of Finance, who did an excellent job yesterday in Parliament in presenting a budget that some persons say it was such a well-balanced and well-presented budget. It's a landmark in the financial planning of the country. But what we should also note is that it is a budget that is designed for resilience, and it has taken into consideration the threat that we face for COVID-19. We are in this position today financially because of the sacrifices the Jamaican people have made. The workers, the businesses, the average man and woman. And we are not about to squander it. So we are going to be using the resources in a way to ensure that Jamaica can recover rapidly from this crisis, and that whatever way we can cushion the fallout from the crisis, that we will do our best. And I again congratulate the Minister of Finance for his presentation. The World Health Organization has now declared this a pandemic. And of course, the sense is that it is now a global epidemic. It is in almost every country. And from history, we know that pandemics have certain phases, and we know the measures that should be taken to contain. And Jamaica is doing all of those measures now. And I believe that we have followed the WHO and PAHO. We have followed the standard practices. And in my opinion, when I read their base protocols, we are sometimes over and above. And we are doing that to ensure that we protect the public health and safety. Ladies and gentlemen, I'm sure you have other questions to ask, but I'm going to ask the Minister of Health if he would like to give some overview on the issues that have occurred since his last update to the nation. Minister.
Thank you, Prime Minister. Ladies and gentlemen, first of all, I want to thank the Prime Minister for his leadership and the Cabinet here for the support to the Ministry of Health and Wellness. Of course, the Permanent Secretary and CMO are here, but there are others who are seated in the audience. As the Prime Minister said, this is a matter of utmost importance, and the Cabinet has deliberated and taken some decisions which was announced by him. In terms of the Ministry of Health and Wellness, we continue to track the situation on a daily basis, and we do that not just from the head offices of the ministry, but in consultation with a range of ministry personnel right across the length and breadth of Jamaica, as well as our bilateral and multilateral partners, PAHO, WHO, but also some countries, bilateral partners that we engage in discussions with from time to time. I want to report that from the public health perspective, we have a plan. We have observed the spread of the virus since January, and frankly speaking, it has played out according to our expectations. Initially, it was about how we delay the possibility of it coming here. So it was about prevention, which is why the border protection, patrol, coordination was so important, both our sea and airports. We anticipated that the day would come, because we are an open society, when we would have imported cases that were picked up elsewhere and brought in. and you're now witnessing the second such case, having confirmed that case today. And there is the possibility, because this is a cycle of these types of public health threats, and we see that playing out in a number of countries around the world, over 120 to date, that there is going to be the next phase, which is the community spread, meaning persons who are here passing it on to others who are here within their community. Well, hope not in this room as of now, but hopefully not. In fact, the CMO will speak briefly on a few cases that we now have in isolation. And that may signal, depending on the test results, that that spread would have started. We hope not, but we're being as transparent as possible. When that community spread begins, the decisions around how to manage the process have to become a lot more rigid. And the Prime Minister, rightfully, having come out of the discussions that we have had earlier, essentially has given a signal to the country that in anticipation of that, some of these restrictions will have to be tightened and enhanced. So the issues around schools, public gatherings, and so on. And it is for a very simple reason. It is not because we want to restrict anybody's rights to their choices in life. It's a simple reason. The formula for defeating this virus in the shortest possible time is to reduce the risk of human-to-human transmission. That's really what it's about. So the more you congregate, the more you spread. The less you congregate, the harder it is for the virus to spread. And we have to take a proactive, preventative approach as opposed to trying to cure. So that's really the key thrust. And the specifics of that, the CMO could speak for a few minutes and give. The second point and final point I'd make is, and by the way, that is why you would have heard today that Boys and Girls Champs has been canceled this year. We had a dialogue. I know the question will come up. And the reality is that the Champs, as celebrated as it is, and something we hail and we are proud of, also involves significant overseas participation, and from jurisdictions that would definitely tempt fate to be diplomatic, because you increase the risk. That's a more appropriate term. In the meeting today, we're told that CHAM sees up to 5,000 persons from overseas coming to watch. These are persons who are old boys and old girls, or scouts coming to scout new athletes and so on. So Minister Grange, Minister Samuda, myself, sponsors, and the organizers had a really intense discussion, and none of us wanted to see this decision taken. We understand and appreciate the disappointment, but the reality is it would increase the risk substantially. And what we want to do is to go through the cycle quickly, because how these viruses work, they start, they reach a point, and then they decline. You don't want that life cycle to be extended, which is why some of these decisions are important. The final point is on the hospital and the public health system and infrastructure. And I want to say to the country, again, with the support of the Honorable Prime Minister, the Cabinet, the Minister of Finance, who spoke to some of that in his well-presented presentation yesterday, that the government has signaled its absolute commitment in terms of resource allocation and expenditure to ready our public health system to deal with the consequences of internal spread. And we are actively engaged now in procuring additional supplies, training our staff members, ensuring we have medicines, equipment, ventilators, beds, all of this in anticipation that if the model plays out the way we expect, we're going to have to see some hospitalization. So we want to reassure the country. It's time for us we need to appreciate the numbers for what they are. No need to panic. just a need to be concerned and to take care as we champion this particular cause together. The final 30 seconds is to say to you that one of the things that the country will have to discuss and understand is the numbers dissected. Even though we have said that over 1 million persons may actually be affected by the virus once you have internal spread, only a very small percentage of that number is likely to be so affected that they would require hospitalization. In fact, the vast majority of persons will have a common cold, a little orange juice, a few multi-symptoms, some rest, and they'll recover. Nobody wants to be sick, so we're not trivializing the risks, but we do not want the country, I certainly don't want the country to think that the introduction and the spread of the virus means that the demise of an entire population and nation. Because that's not the experience in other countries. It's certainly not going to be the experience here. So we want to minimize the risks, but we want Jamaicans to recognize that it's not a death sentence. So let us approach it in a way that will overcome without having to panic. I'm going to ask the CMO now to do a 5-minute presentation. Thank you.